And last but certainly not least, Dr. Aziz, you have the floor.
Thank you so much. My name is Maya, Dr. Maya Georges Asi. I'm a dentist practicing in the state of Florida for the past 18 years. I'm also a mom of 3, and I'm very honored to be here in front of all of you today to share my insights on fluoride. I'm not going to go over the studies, but I'm going to hit 3 main topics which I want to drive home to every single person in here today. The first thing, if you're a patient at my office, what I'm going to do first is I'm going to sit with you and assess your risk for caries. This is what we're supposed to do. Based on our assessment, we then prescribe x-rays. We then prescribe what type of cleaning. We then prescribe any medications, if any, and we then prescribe any procedures. Why is it public health protocol to put this medication in the water without assessing risk from individual to individual? We know now that fluoride is a developmental neurotoxin. This is what this means. If my son, who's 5, drinks a glass of tap water, and I, who am an adult, drink a glass of tap water, we're going to get a different effect because we are in our different stages of development. So mass medication without risk assessment is not the correct public health policy. Furthermore, informed consent is very important. If you're going to have a procedure done by me in my practice, I'm going to go over the risks, the benefits, and the alternatives. I'm going to give you the informed decision to make an informed consent to agree or disagree. Putting fluoride in our water does not give this to our citizens. This takes away our right for informed consent. The next thing I want to tell you is where this comes from. People will stand up here and tell you that a fluoride ion is a fluoride ion is a fluoride ion. This is incorrect. The fluoride that's being added to our water by municipalities is hydrofluorosilicic acid. This comes from smokestacks, scrubbers attached to smokestacks in industrial factories, which captures this contaminated fluoride and then is being shipped to our municipalities to be added to the water. I'm not okay with that. Neither should you. Also, did you know that the FDA has never actually approved hydrofluoric acid to be ingested? Look it up. Fluoride is not essential to the human body in any way, shape, or form. Yes, it's a naturally occurring mineral, but it's not efficient. Ladies and gentlemen, there is no such thing as a fluoride deficiency. That does not exist at all. Actually, the root cause, like my colleague discussed, is the lack of nutritional concepts, the lack of breastfeeding, which is causing us to form jaws that are crowded, mouth breathing because our jaws are crowded and misaligned. This is the root cause. The root cause is not fluoride deficiency, and it never will be fluoride deficiency. You will not see an increase in cavities when we remove fluoride from the drinking water. Lastly, I want to tell you this. We should not be the ones having the burden of proof to remove fluoride. The burden of proof should be on those who advocate. There have never been any double-blind randomized studies assessing the long-term effectiveness of fluoride in the drinking water. Look it up. When it comes to public health, we must follow precautionary principles, which does not say you act in the absence of evidence. It says you act in the presence of concerning evidence. And that's what we're here to urge you to do today. Thank you, ladies and gentlemen.
Thank you so much, Doctor, and thank